this edition of the Lynne Hayes Freeland Show. I can honestly say I probably got, this will be a gotcha moment because I'm sure that most of you assumed we were going to talk about the verdict in that case in Minneapolis. But guess what? We're not talking about that today. We'll get back to that when it comes to sentencing. I'm just over that for right now. There is another crisis going on in our community, one that probably, because of everything that's been happening recently, we just haven't been spending a lot of time on it. And it is maternal health, the health of Black women. It's at a crisis level. And joining me today are three individuals, three perspectives that all share, they probably far exceed my concern about this, but they've gathered together to help us explore what some of the issues are and how we as a community can make a difference. Three women, beginning with Veniese Lawrence. Veniese Lawrence is a certified nurse practitioner and a certified nurse midwife. She works with UPMC in Williamsport. Welcome to the show. Jessica Johnson is the director of surgical and anesthesia services, as well as the chair of the inclusion and diversity initiatives at UPMC Magee Women's Hospital. And Dr. Sharee Livingston is the chair of the OBGYN program at UPMC in Lidditz. I learned Lidditz, Pennsylvania today for the first time as well. Welcome to you all. Thanks so much for joining us today. And Dr. Livingston, let me start with you because when I say there is a crisis when it comes to Black maternal health, that really is not an exaggeration, is it?
It's not an exaggeration. And Lynn, thanks for having us this evening to discuss such an important topic, and a topic that as an obstetrician gynecologist is very near and dear, because 99% of the time I get to see the good things that happen, but a small percentage of the time when things go bad, they go really badly. And unfortunately for our Black and brown women, those numbers are astounding. 3 to 4 times more likely to die in childbirth than our white counterparts. And that is why we're here tonight to discuss that.
And that almost seems like one of those statistics that the entire community should be alarmed about, but I don't even think that most people even know about it.
Well, see, from 1990 to 2015, we saw a global decrease in maternal mortality. And so we got very comfortable with that. The problem is the United States didn't follow that trend. And so we actually, of all the countries with who are considered developed countries, we see a rise in our maternal mortality rate. And there's, as you'll hear tonight, there's so many contributions to that, but I think everybody got very comfortable with the decreasing trend. And for the United States, that just wasn't the case.
And Veniese, let me ask you, and I mentioned to you before the show, I'm so excited that you're here because I think it's important that people see a midwife that looks like you. I just think that's important. And when we talk about then this crisis, there are so many different factors that play a role in it.
Some of the factors that play a role in the increased mortality rates is access to care is one of them. Representation does matter. When a patient walks into the room and see a midwife or even a physician who looks just like them, they become comfortable and they sit down and they listen and they relax. I see that all the time with where I work, where women, it seems like they lift the burden off of their shoulder by just seeing someone who looks just like them. That's another factor is in the United States, there's not a lot of Black or brown physicians that look just like the patients involved in this crisis that's happening right now. Systemic racism also plays a role. Like I said before, access to care. There is not a lot of hospitals in a lot of the urban population. For instance, I worked in DC, and living in DC, there was not a lot of hospitals in the lower minority population. So that affects access to care. Food deserts play a role as well. If we're talking about healthy living and healthy eating, if we don't have access to healthy foods and healthy food options, then that plays a role in the comorbidities that come along with the high mortality rate.
And Jessica, it's interesting as I listen to Veniese as well describe all of these contributing factors. I think a lot of times people think, well, that's in the more rural areas. We're in the city. It's not an issue here in the city. But some of the very same issues that she's outlining are issues in urban populations, everything from doctors that look like us to food deserts.
It's everywhere. It's across the country and it's across the state. Everywhere you slice it, the data, we see the disparities loud and clear. You can categorize them around social determinants in different ones, but it's been clear for a long time. And now it's, moving beyond accepting the data and adding action to it to reverse some of this data and meeting patients where they're at. And it's not just those that have needs or are in food deserts. We know that this is happening to Black women that are highly educated just at the same rates as well. Mm-hmm. So even when we see Black women that have overcome some of these social determinants, they still risk having a poor outcome because of bias that can take place in the healthcare setting. And so we need to be aware of that, and we need to listen to our Black women when they're giving childbirth.
I was going to say, before we take a commercial break, I want to just pick up on that, because a lot of times when we say access, people assume that means the ability to get somewhere. If you can get there, you have access. But I've always believed that access means a lot more than that. It means how I'm treated when I get there, how people look at me when I get there, if they hear me when I'm speaking, and all of those will become factors in terms of what my experience is going to be.
Correct. And so we need to go beyond listening for an outcome and listening for our patients for their direction, their input. And so we can partner with them, and listening to our community partners who know our communities best. And that's what we're committed to. And we're seeing a lot more of it. And that's where we're seeing better outcomes coming from that.
We have a lot more to talk about today on the Lynne Hayes Freeland Show. Stick around. I know you knew nothing about this, but I bet you're glad you tuned in. We'll be right back.